joining us from. And for those of you who are in now and would like to change your name from meeting participant, you can go into your participants tab and you can right click on the three dots and change your name so that we can see who you are. All right. So with that, again, my name is Josephine McMurray, and I'm a professor at the Lathrop School of Business and Economics at Waterloo University in Ontario, Canada. And I'm also the Associate Scientific Director of the Age Well National Centre of Excellence, which is a pan-Canadian network that brings together researchers, older adults, caregivers, partner organizations, and future leaders to accelerate the delivery of technology-based solutions for workers who are identified. So I'm also working on a project called Cog at Work, which is exploring employer perspectives on workers who are identified with mild cognitive impairment or early onset dementia at work. And it's this research which prompted our interest in this topic and a burgeoning partnership with Dr. Philip Taylor, who is the chair of the GSA Older Workers Interest Group, and coincidentally with our speaker today, Dr. Louise Ritchie. So on behalf of my colleagues on the Cog at Work project, Dr. Anne-Marie Levy, Dr. Jen Boga, both who are here today, Dr. Aline Estelle and Dr. Christina Kokorelius also here, and Dr. Taylor, I'd like to welcome Louise and thank her profusely for coming to chat with us today and to help expand our understanding of her work. So Dr. Ritchie is a reader in dementia research at the Alzheimer's Scotland Centre for Policy and Practice at UWS. She has a BA honours in psychology and a PhD in psychology from the University of West Scotland, which explored the design of care homes for people living with dementia. Louise's research focuses on understanding the experiences of people with dementia and developing research-informed interventions that can help to improve the lives of people living with dementia, their families, and people who care for them, with a particular focus on those who are diagnosed with young onset dementia and the impact of employment. Louise has been an executive committee member of the Scottish Dementia Research Consortium since 2019. Now, just in chatting with Louise today, she has some slides and as part of her presentation, and she has offered that if you need points of clarification, just pop up your hand or put a text in the chat box, and Anne-Marie has volunteered to keep an eye on the chat. So Louise is happy to have you stop her if there are points of clarification. If you have other larger questions, please pop them in the chat. Anne-Marie will be keeping track of those, and we can open the floor up for discussion at the end, and we can run through those questions. And of course, any others that you have, if you'd like to ask them orally at the end. So without any further ado, I'm going to hand this over to Louise so that she can share her screen. And I will mute myself and I'll allow Louise to take over. Thank you, Louise.
Thank you, Josephine. I'll just give it a wee second to that. So I'll get a wee nod or thumbs up. Everybody can see that screen. Is it looking okay? Yeah, good. Okay. Thank you so much for having me tonight. Or well, it's tonight in Scotland. I'm sure it's various times of the day and other areas of the world. I'm really pleased to be here and looking forward to talking to you tonight. So what I'm planning to do is talk about dementia in the workplace and the work that we've been doing in Scotland for almost 10 years now. We started in 2013 in this area. What I want to do is give you a bit of a reflection on where we've been, what we've found out, what we know so far, and a bit of forward thinking about where we're going and what we think should happen to support people living with dementia who are diagnosed whilst in employment. And hopefully by the end of it, I'll have convinced you that the way to go is to develop person-centred approaches to employment support and decision making. Oh, sorry, this is the thing that tripped me up earlier. So I'll just start with giving you a bit of an introduction to the area, why we need to focus on dementia in the workplace. I know that most people here will be here through an interest in dementia in the workplace. So I'm hoping that I don't need to convince you too much that this is a really important area to explore. I'll then talk a bit about what the experiences are of employees who develop dementia from some of our research. I'll talk a little bit about the employer's responses and the support that's available to people living with dementia. We'll think a bit more about the theoretical frameworks that we're using to understand what's going on for an individual who develops dementia in the workplace. And then I'll talk about the person-centred approaches that we are developing at the moment with some of my colleagues who I've just noticed in the room. So I'm glad to see some familiar faces here as well before we go into the discussion. But as Josephine says, if there's anything that I say that you want clarified, or if I get carried away with my West of Scotland accent and you miss something, please just stick your hand up and let me know, and I'm happy to just stop and clarify any points there. So before I start, as I said, I'm in Scotland, in Paisley in Scotland, which is just close to Glasgow at the moment. I wanted to just take a wee moment because today's the 30th of November for most people. I know Philip's in Australia, so it's already the 1st of December. But today's the national, the patron saint of Scotland's day. So it's St Andrew's Day. So it's a holiday for some of the schools here, and most people are having haggis for their dinner in commemoration of St Andrew. Scotland is a small country. We've got about 5.5 million of population. We've got some really densely populated urban areas, but some quite sparsely populated rural areas. We also have an ageing population, and estimate that around about 90,000 people in Scotland have dementia, and around 3,000 of them have early onset dementia. These numbers are obviously subject to the stats that we collect, and probably aren't as representative as we think. But we are in a strong position in Scotland because of the size of the population to really develop some good support and health and social care support for people living with dementia. And we've done that over the last sort of 10 to 15 years through the dementia strategies that the Scottish Government have launched. So everyone who's diagnosed with dementia in Scotland is entitled to a year's post-diagnostic support. And that's an important point that I'll come back to later. The year's post-diagnostic support varies in what it looks like and actually how many people access it. It's not fully integrated into practice yet, but it's a really important initiative that could help people in that post-diagnostic stage. And again, it is really person-centred, and the strategies and the approaches to dementia care in Scotland are all rights-based. So it's all about the individual and supporting their needs. So that is my bit about the background in Scotland. As I mentioned, we've got an ageing population, and as a result, like many other countries, we have an ageing workforce. And this is increasing due to the changes in national retirement age and state pension eligibility age. What's important about this is that we can see the trends of the increase of more people in the older age groups in work, particularly in that 65 plus. And we also know that your risk of developing dementia or cognitive impairment increases as you age. So we know, looking at these figures, or we can predict looking at these figures, that more and more people, as people work into later life, will develop dementia whilst they're still in employment and will require some sort of support. Some colleagues of ours, Valerie Egdell and Jill Stavert, had a look at what support's available to, or what's the legislative framework for supporting people. And they drew on the current framework that we have in the UK for supporting people with disabilities in employment and other areas of society. And the two key parts of legislation that they drew on was the Equality Act of 2010 and the UN Convention on the Rights of the Person with Disabilities 2006. These are both really important parts of the legislative framework because they can be adapted to support. Okay there. So they can be adapted to support, but there's some key sort of grey areas around about how dementia is defined as a disability that can cause some issues for employers particularly, and how they interpret this, but they are there in theory. They do support and promote the rights for people to continue employment. I'm getting a bit of cross noise, I don't know if it's just okay. So, as I said, in 2013, we began looking at this area of research. So looking at what the experiences of dementia in the workplace were for those that were diagnosed. Up until that point, as far as we could tell, there was nothing done in the UK, and there was very little internationally looking at the experiences of people with dementia. And to be honest, in 2013, when we started the work, it was really difficult to get anybody to talk to us about dementia in the workplace, because nobody felt as if it was their area, if it was an area of expertise or an area that should be of concern. But we worked to get the funding for the research, and we worked to try and convince people that this was really important. And one of the ways to do that was to get to the people who would experience it and record their experiences. Once we'd found out their experiences, we then looked at how employers responded to dementia in the workplace and what the policies and practices around supporting employees with dementia were, or if there were any at all. We then worked, drawing on the findings of the two previous studies, to develop resources to raise awareness of the issues that people are facing in dementia in the workplace, and to help signpost them to the support that is available. There is limited support there. And then finally, now we are working on an intervention development to support people working with dementia, and I'll talk about that at the end of the presentation. So, as I said, first of all, what we were interested in was looking at what the experiences of those diagnosed with dementia in the workplace really were, and what happened to them, and was there potential to continue working post-diagnosis. So we carried out 17 case studies of people who had been in employment when they were diagnosed. And these case studies all varied in experience. There were many people who had continued working successfully, but there were also about 10 of the case studies, the person didn't continue working and had a negative impact or a negative experience with employment after their diagnosis and before their diagnosis. This chart here just gives a bit of an overview of what the experiences and what the pathways that people who were diagnosed with dementia whilst in employment had. So everybody in their case studies first experienced problems at work, and they noticed that the problems at work were perhaps they were forgetting, making small errors, or they weren't performing to the level that they used to perform and couldn't explain why. And that was for most people the instigator to getting to the doctor to start the diagnosis process. Diagnosis was then the key to getting the workplace support. So if the person was still at work and was still managing to continue working, getting that diagnosis managed to help them get the support in place, which would then allow them to continue employment. And if they continued employment, it let them make the decision to take retirement, but it was their decision. It just gave them that period to adjust to their diagnosis before making the decision to end their working lives. On the other hand, people who had problems at work and had a lengthy period of diagnosis tended to end up having to go off on sick leave from their employment. And this might mean that they weren't coping at work, they had high levels of stress. When they got their diagnosis, they felt that they had been out of work for too long and it was too difficult to go back. or they had been made redundant, or had been subject to disciplinary procedures, or offered early retirement. And I think just to illustrate some of the issues that people had in with their work, I've decided just to talk through some of the key points of 3 of the case studies that we have, just to give you some of the ideas of the types of person-centred and individual experiences people had, and the points of decision making that they needed to make or didn't have the opportunity to make. So first of all, I'll tell you about John. John worked as a prison officer, but he had trained as an electrician, and in the prison he worked with prisoners to develop their technical skills so that they could train to become electricians as well. So he'd always maintained his technical knowledge. He was diagnosed with a rare dementia when he was age 49, and he was told at that point that he could no longer work or drive. That was a really devastating diagnosis for John. He found it really impacted on his well-being, his mental health. And he went home and he sat, in his own words, sat at home for 2 years, waiting for the decline that the doctor had told him would happen rapidly. When he realised that 2 years had passed and he'd been put into day centres, that he was with people who were maybe 20 or 30 years older than him and really couldn't settle in there. He realised that he wasn't as unwell as the doctor had told him that he was going to be. And he started thinking, actually, there's other things I could do here. There's skills that I could use, and found a job advertised as a projectionist in the local cinema. And his job was to then go in and work using the projection equipment, turning on the films, turning off the equipment, making sure everything was safe. And it was using these technical skills and allowed him to develop these while he was working. And he was really surprised that he got the job, but it was one of the best things that happened to him, as he said. Unfortunately, he then lost his job because the cinema went digital and there was no need for his role anymore. But rather than sitting back in the house, he decided to look for other work and found voluntary work, working at the local charity that repurposes furniture to those in need, and did the electrical testing on there. So it gave him a purpose and it gave him a way to use the skills that he had and maintain his skills. The next case study is Jack. Now, Jack was a telephone engineer and had most of his days worked out in the field. And in his own words, he was up poles and down holes. He was diagnosed with dementia at age 53, but about 3 years before that, he'd moved from his outside work into an office-based role that allowed him, that meant that he was responsible for assigning the jobs, assessing the jobs that were coming through the system and assigning them to the appropriate engineer. When he was diagnosed, with the support of his wife, he went to his line manager and disclosed his diagnosis, and instantly was put onto the internal disability policies to develop what they call a health passport, which is an agreement between the line manager, the employee and the doctor to look at the adjustments that are needed, both formal and informal adjustments to help Jack maintain his work. And some of the adjustments that Jack agreed with his line manager were to have a standard work pattern, to have no changes in shifts, so working the same shift every day, to have a quiet area for him to work, so not in an open plan office, but having an area that he could go and work without distractions, and to have informal support mechanisms, such as being able to email a colleague when he was feeling overwhelmed with work, and being able to ask for 10 minutes out and have that space to relax and chill out when he needed it. And that works really well. So when I met Jack, he was still working and had been working for 4 years since his diagnosis. So the open conversation and the support that was offered through the disability policies allowed him to continue working successfully. We also have Alison's story. So Alison was a maternity care assistant and was diagnosed age 52. She had begun making mistakes in her work, and obviously she was in a safety critical role. Rather than these being addressed with Alison directly, her colleagues were asked to covertly observe her and to report back to management about the things that Alison was doing on her shift, which Alison found out about. She got really upset about that, as you can understand, and eventually went off sick before she got her diagnosis. She got her diagnosis after a period of months and went back to her employer, and their offer to her was that she could take early retirement, or they could offer a redeployment to a less safety critical role. But unfortunately, Alison and her husband, as he said, this is a quote from Alison's husband here, they felt that they didn't actually address the redeployment. They didn't want her to be redeployed. They wanted her to take the early retirement route, and they didn't really tell her what redeployment would look like. So Alison didn't get the choice to decide what she wanted to do with her own career, and the options that she had really were very limited based on the support that she could access. So that's some of the experiences of people who have been diagnosed with dementia and employment, and you can tell they're all very different, and the outcomes are very different for the people as well. So the next part of our research went to look at how employers were supporting employees with dementia, and this was a project that was led by Professor Jill Stavert in Edinburgh Napier University that we were partners on. It's a survey of about 300 employers in Scotland looking at their knowledge of dementia and their policy and practice and how they might apply it to supporting an employee with dementia theoretically. It was then followed up with employer interviews, 20 interviews exploring it in a bit more detail. What we found there was that similar to every employee who develops dementia, every workplace will have a unique experience of employees with dementia too. We found that there was a high level of knowledge of what dementia is from the way employers reported it to us, but they struggled to be able to apply that to the workplace. So people who'd never experienced an employee with dementia, for instance, couldn't see how a person with dementia could continue employment. And there was a tendency to make knee-jerk assumptions about their abilities and want to make best interest decisions on behalf of the individual rather than allowing them to make the decision about whether to continue. And what employers tended to think was in the best interest of the employee was to not to be working anymore post-diagnosis, rather than having a decision, having the power to make their own decision. So, and then similarly, there was strong knowledge about the fact that dementia is a disability, but the employer struggled to be able to apply it to the legislation that was there and how it might protect an employee with dementia. So there was clearly some work to be done. What we did after the two projects that have been completed was to develop a resource that helps to give some information and to provide signposting to where people can get support, and that includes for employers as well as employees and people working in HR departments of organisations as well. There's been other resources that have been developed in the UK as well by the Alzheimer's Society on employment and by Martin Robertson, who might be in the room today, I'm not sure, who has developed a peer-to-peer resource that was funded by the Life Changes Trust in Scotland, which is about his own experience and his own research on work after a diagnosis of dementia. And we can share the links for these if anybody's interested at the end as well. And if Martin's here, he might tell you some more about it when at the end in the discussion section. So The most recent work that we've done was to try and look at actually what do we already know about dementia and how can we apply this to the theories that are already there to help us target the support interventions that we're developing. And the way that we did this was to carry out a secondary analysis on the data from the two projects that I've just spoken about, to look at how the sustainable employability framework that was developed based on the capability approach by Van der Klink in 2016, there's a wee typo on that slide there, which looked at essentially sustainable employability is that the individual is able to and is enabled to continue working. And the factors that are involved in that are the personal and material resources of being able to, having the opportunity to, and these are unlocked by the physical and social environment which allow them to be facilitated. They are facilitated and allowed to continue working because of the environment that they're in. So from that, we've identified that an employee with dementia may require support to identify their skills and expertise. Like John did in his case study, he identified that he had the skills to continue working and sought the support, but not everybody would have the motivation and the knowledge to be able to do that on their own. They need support perhaps in identifying and signposting appropriate services, such as in Alison's case study, to be able to speak to perhaps a union representative or someone who could support her more in that decision making process through with her HR department. And they may also require support to access appropriate opportunities. So similar in Alison's situation, actually working out what a redeployment opportunity might look like, or are there other opportunities for her to use her skills. So from the research that we did, we highlighted these key issues, and I've probably touched on most of these as I've spoken through the previous slides. But a couple of the things that were really important in terms of understanding how we support someone to develop or to continue employment, retain employment, or find new employment, were the personal resources being their impact of symptoms and the insight into abilities and the individual factors and motivations. So how does the dementia affect the individual? How does the individual see the impact of the dementia on themselves? And what are the individual's motivations to continue working? Because as I say, some people were relieved to stop working. Not everybody does want to continue working. People want to have the opportunity to make the choice based on their own well-being. We then had the material resources, which are really important too. And one of the key things that were important in the being allowed to is the diagnosis. So diagnosis is really seen as the key to unlocking support, and there's a debate to be had around about that, because there's support that's required in the pre-diagnosis stage, but it's really difficult to access any sort of support there. The policy and the legislation from the environment that the organisation is working in, and also within the organisation, was really important as to how it would adapt to support an individual with dementia, as well as the employment type and the organisation. And again, link it back to Alison's case study. What about the risk that's to Alison and to others in that type of work? And how can we support Alison to continue something that lets her use her skills, but doesn't put anybody at undue risk? And finally, the physical and the social environmental factors were really important, because if they are not there, then the material and the personal resources can't work together to create this employability framework. And the key things that were important there was the role of stigma and the lack of understanding of dementia in the workplace, and trying to put measures in place to reduce that, so that people understand the impact dementia has and don't base it on what they see on the television, for instance. The workplace relationships, so including the formal relationships like the line manager, but also informal relationships and the support that might be available from colleagues, such as what was available for Jack in his case study, and the workplace culture. So what is the support there for the individuals, and how can they how is that normal practice, or is it not? You know, are people not used to helping each other out? So we have done all that work, and we started thinking, well, how can we take this further, and how can we develop these person-centred approaches? And a chance conversation with one of my colleagues, who is a lecturer in career guidance and development, Dr. Emma Bolger at University of the West of Scotland, got us thinking about the role that career guidance might play. Many people may have experiences with career guidance. They may think about the experience that they had in schools. I know that I did that. I felt as if career guidance was something that focused on children, particularly in high school, as they are making that jump to university and to think about what they want to do as a job. But actually, career guidance is much broader than that, and takes a lifelong approach. And good career guidance really enables individuals to make informed lifelong career decisions. And within this, career isn't about the sort of financial gains from developing your career. It's much more linked to well-being. So, for instance, what John did in with his career is he used his skills and he found opportunities that helped him maintain his well-being. It wasn't particularly about the financial gain. It was about him feeling useful and using his skills and feeling good about himself. So that's what career guidance does, and it takes a real person-centred approach. It looks at the individual's skills and the workplace that they're in or that they would like to be in, and considers how we can work together. So we are in Scotland now, and Laura and Rachel, I think, are in the room with us today, are working on a project over the next, well, 3 years, but we've got 2 years left to run, to develop an intervention using the career guidance methods that will support people living with dementia to make decisions around about their employment. And that will be including people who decide they don't want to continue employment post-diagnosis. But the focus will be that it will be the individual that makes the decisions, and each individual situation will be addressed within the intervention to find the best outcome for that person. So I'm hoping that I'll be able to come back in maybe 1 or 2 years and share the intervention that we've developed and tested in the UK to see how it's went. So just to finish up, before my throat dries up, as we know, each individual and each workplace has a unique experience of dementia in the workplace. We know that appropriate support at an earlier stage might prevent the loss of employment, and that employers and employees and health professionals as well need support. We hope that by using a co-production approach in our new project, we'll be working across the disciplines as well as with people with dementia and their families. And we'll work with health professionals who probably are working in that post-diagnostic field that I spoke about at the start, and career guidance professionals to develop something that will work for people in the post-diagnostic phase. We know that raising awareness of dementia is vital. Dementia in the workplace is vital, and we need to continue doing that, but we need to move it forward and look at actually what support is available, so that people who are diagnosed with dementia whilst they're still in employment get the opportunity to realise their capabilities as they're moving forward. And that is me for now, so I'm happy to take any questions or discussions that.
Thank you so much, Louise. That was fantastic. Absolutely fantastic. And I'm wondering if perhaps you could stop sharing your screen, and we can just open this up to the floor. For anybody who has any comments or questions that they might like to ask Louise. maybe I'll just start the ball rolling while people are thinking. I was really interested, Louise, to sort of hear you talking about disclosure, and that this, this is such a crucial mechanism for people who are become aware of perhaps some of these symptoms around accessing support and benefits. And that process of disclosure is entirely driven, for the most part, by the employee. And so you started talking a little bit about that support that's required in the pre-diagnosis stage and how policy and culture are really important at that stage. I'm wondering if you could talk a little bit about your thoughts on this disclosure piece, and how might we make, as employers, how might we help them to make spaces more trusting for employees, that they actually do open up and disclose, not necessarily a diagnosis perhaps, but at least start that conversation that might get them access to some of those benefits and supports that could help them to manage their work life while they're in that diagnosis stage.
Yeah, it's a tricky one. I think there's lots of, and you can understand people's reasons for not wanting to disclose, and it comes down to the culture that you're working in and the stigma that surrounds dementia. I think the awareness raising of dementia in the workplace is really important, and making it something that isn't this terrible thing to do, and that idea that people can continue working is really important.
Yeah, and it's interesting because you actually made that, you talked about education, and talked about education. In our experience with our small number of case studies, ours was actually flipped. We had employers who had a low level of understanding of dementia and a high level of understanding of their obligations when it comes to disability, which is kind of interesting. But what we haven't factored into this is this idea of physician education, and one just assumes that they know. And you described a situation which actually just sort of raised my eyebrows a little bit, where someone was telling an employee, or at least their patient, what the outcome of their disease might be. So I'm just wondering if you have a comment around healthcare providers and how they might factor into that education piece.
Yeah, I mean that's one example of some things that can make your jaw drop from doctors' comments, and I think the diagnostic process can be so run of the mill for a doctor. They don't think about the impact of what they're saying. The other one that always stuck with me is when I spoke to a GP about how he would go about diagnosing somebody, or referring somebody on for diagnosis who was younger than 65, and he was very dismissive of the fact that anybody would even come to him with a dementia or concerns about dementia at that age when they were still working, because his view was, if they're still working, then how can they have dementia? And you're right. I think that the physicians are really important, and having that point of when an individual comes who's still in employment, regardless of what age they are, that the doctor knows that actually we need to address this at the employment issues as well, and we need to know where to refer them on to. And I think that's the project that we're working on just now, and that's why we're trying to work across healthcare, practice, and the lived experience within it, and the co-produce, so that everybody sees the value of it.
So you're actually trying to connect the functionality that these employees are their behavior, what they're able to handle, with the matching it up with sort of job requirements.
Yeah, I think it's probably not quite on that level, but it will be more about the healthcare providers understanding the importance of career and the value of maintaining and supporting employability, and the healthcare and the career guidance having a deeper understanding of the knowledge and understanding how that might impact on the individual's abilities.
I don't want to, if there is anybody else who wants to just chime in, please feel free, just pop up your hand, or I'm happy to have you chime in. The other thing that I was curious about was this health passport you talked about. It was this sort of triangle between the physician, the manager, and the employee that you described. And I was wondering if that was something that was more ubiquitous in Scotland, whether it was a known entity or whether that was just one, that actually just happened with that one employer. I wonder if you could give us a little bit more about that.
Yeah, it was more that it was just that one employer. There was less of a, that was the anomaly probably, because that organisation had really good disability management procedures in place, and the line manager, they'd had dementia awareness training, so the line manager knew enough to know, okay, this is just how I would address any other. They weren't scared basically of the impact of dementia.
Yeah. Yeah, I'm just wondering if I can invoke Anne-Marie here. She's working on the Cog at Work project with us and has been doing a case study with a large employer here in Canada. And maybe, Anne-Marie, I wonder if you could sort of maybe compare and contrast some of the early findings that you've had that might help others in the call, perhaps have a different context with respect to this as opposed to Louise's research?
Absolutely. And I just wanted to also point out there's one more question in the chat that we have to get to as well.
Oh.
So perhaps we can address that first before I jump in.
Sure. Happy to do that. Do you want to read the question out? Thanks.
Monica asked, would you suggest any potential training for employers or physicians, such as webinars or podcasts, for communicating and working with employees or patients with dementia?
So we have some programs in the UK called Dementia Friends. I think there might be international versions of it, which are really basic awareness training, but they've been really popular in organisations across the UK. They're quite often delivered by people living with dementia as well. That's one that is kind of a good one, and some of the organisations that deliver these have a sort of step up, and we've been involved in developing the curriculum for organisational, so that the kind of what we've uncovered so far in the research is informing that training. So that would be the key thing that I would recommend as well. I can see Laura. I don't know if Laura, if there's anything else that I'm forgetting. Laura's works with me on the project just now.
Hi everyone. There are some organisations that specifically work with carers and act as a kind of intermediary often with people who are living with dementia and employers and often healthcare workers. So I think some organisations will take an intermediary role where people are kind of proactive about that. So certainly people are reporting different experiences, and from a lot of the interviews that we've done, a variety of experiences across the board. So similar to the way Louise has described, where sometimes you get a very proactive health passport and people are able to actively work with healthcare professionals, but can be quite variable. But the Dementia Friends is certainly a very well-known route.
One of the participants in our case studies actually trained as a Dementia Friends. Before she disclosed her diagnosis to her workmates, she trained as a Dementia Friends trainer and used that as her way to disclose her diagnosis. So she gave the training, and then at the end said, and the reason that I'm giving you this training is because I have had a diagnosis, and this is my experience, and this is how I want to continue my work life.
So Louise, I mean, in these organizations that you've done the case studies in, did you find that the messaging from sort of the top levels of the organization were consistent with what was happening on the ground, or at the sort of the work face?
No.
And how important is that messaging, do you think, for moving forward?
think in the case study that I spoke about there with the health passport, absolutely it was, you know, it was all filtered down, and the culture was there. There was a couple that just absolutely wasn't, like Alison, maternity care assistant. Her view was that organisation should be supportive and does have the knowledge and skills and to support her, and her experience was the opposite. So
Interesting. Emery, I think you have another question.
Yeah, no, what was your original question? Now that we've done 3 more for me in terms of comparing and contrasting the health passport piece.
Well, yeah, it was actually related to that health passport, because there is your company or the company that we're doing the case study on has one.
Yeah, it's a very similar initiative they're taking with our case study as well, and it's got mixed reviews. Again, it has unilateral support across the organization from the top down, but when it comes to the employees who are choosing to use it, there's trepidation because they are concerned that it could be used to prevent them from being promoted, moving into positions that they want to move into, and while they are looking for ways to streamline the accommodations process for them so they don't have to repeat their experiences and their functional needs over and over again. Their experience, like you mentioned, Louise, is inconsistent with the messaging in terms of what actually goes on. And so that doesn't give them the confidence that using that passport in the way that it's meant to will enable them to continue to move up in their career. So there's a lot of trepidation. And it's highly informed by the position in the organization. Knowledge workers are less vulnerable to that than other types of service providers within the organization. So there's a lot of factors that impact these initiatives that are meant to have such a good impact, but people's lived experience versus what messaging is kind of mediates that process. And we have one more question here from Philip Taylor. So is young onset dementia viewed alongside other areas of neurodiversity by employers, or is it considered separately?
yeah, I think, to be honest, it wasn't really considered at all. Only in the last sort of 5 years probably that it's been considered, and I don't think it's considered in the same bracket as anything else, any other neurodiversity at all. I'm not sure if you find the same.
My understanding when I speak to people is people don't know where to stick the definition or the disabilities related to mild cognitive impairment or dementia along learning disabilities or intellectual impairments. There's kind of a blurring of difference between learning disability versus a cognitive impairment.
So what we find in the UK particularly is dementia generally gets lumped into mental health. And it's a point of contention for a lot of people as well. It's not a mental health condition. It's
Absolutely.
They don't really know where else to put it. And when you've got young onset dementia, depending on what area you work in or you live in, the pathway that you get to getting a diagnosis can be so varied between services for older people. Some have specific services for younger people. It's very varied, and there's not a consensus on how to approach it.
Yeah, I think one of the pieces that causes confusion is that we talk more about the diagnosis versus just the functional limitation, and many of the disabilities related to these diagnoses are similar. Someone who's living with ADHD or a different learning disability will have the same functional limitations as someone who's living with mild cognitive impairment, and there's some overlap. And I think that it's the language that kind of creates that problem sometimes, because what we really should just be talking about is what your needs are from a functional perspective.
Yeah.
I see Aline Estev's on. Aline, did you want to jump in here?
Well, actually, it was a different question, but I was just thinking, it sort of relates to the disclosure thing, but also I wanted to ask Louise about your experience of involving, or if you've attempted to involve colleagues or other people involved with any individual, because we just recently finished the study between Canada, Sweden and Finland, and we had originally planned to when we were recruiting cases, that we would try to bring in people who'd been involved in supporting them, whether it was family, but also workplace. And we found that it did happen in a couple of cases in Sweden, but in Canada particularly, it didn't really happen at all. And that was partly because people had not been disclosing their difficulties. And I wondered if you had any experience of involving or engaging with directly with the employers and colleagues of individuals you were working with.
Yeah, the case studies, so it's slightly different because the people who participated in our case studies had all disclosed their diagnosis, so they did, and they were quite happy to, but we only spoke to people who the participants referred us on to. And we did speak to, not in every case, but in most cases, there was at least one person from the workplace and one person from their family who we spoke to as well. There were one person had a really difficult exit from work and didn't have contact with anybody anymore, and didn't want us to speak to anybody, which was fine. One person had given me details for their employer, and the employer never responded to anything and didn't engage. And there were some ethical issues we had to deal with as well at that point, because we had to make sure that we had finished all of our data collection with the individual before approaching the employer or anybody related to an employer, in case we found out anything about their employment or their situation that could impact on their employment as well, and disclose it back. So there was some ethical issues too.
Right. I think it's interesting though, because I'm also wondering if that piece around the disclosure goes with the awareness, and as Anne-Marie said, because there's sort of lower awareness of dementia in the workplace, and also certainly in Ontario there isn't a requirement to disclose a diagnosis, but of course that affects then your access to accommodations. But I did wonder if there's a difference in, because of awareness, people are just afraid. And also, of course, there's a situation of people being out of the workplace before they get the diagnosis. So I'm going to put my phone, I'm on my phone, I've got problems and there's a lot of background noise, but thank you so much. That's really helpful.
Just as a point of interest, there are jurisdictions in Canada where the diagnosis is not required, that one just has to make the statement. So the diagnosis is not required to actually access the benefits that that could help. I'm just going to hand off now. Philip, I see that you've got your hand up.
Yeah, and Louise, thanks for a fantastic presentation. It's really interesting. I just wondered if in any of your work you'd looked at the impact of young onset dementia on retirement planning, retirement transitions, because I mean, thinking about your case studies, one imagines that this experience would, if along with everything else, have a devastating impact on retirement wealth. And I just wondered if you have any comments.
That it wasn't something we focused on specifically. There was a few examples of one of the examples that we had in the case studies was the man who's a judge, and he had made the distinction between he was no longer he was given early retirement, ill health retirement, but he was no longer able to go back and practice sessionally, and his contrast was to colleagues perhaps who had ill health retirement due to a cancer diagnosis, who could go back and earn, I think it's £750 a day as a sessional judge, and he didn't have that. So yeah, there was definite issues, and particularly another one around about a young man would have been about 50. They had lost their house because of the impact of loss of employment as well. So it's maybe not even retirement planning, it's the financial implications are huge as well.
Sure.
Interestingly enough, some of the, when we were doing our research on the policy review, there was a surprising amount of education in the legal profession, particularly in the States, around dementia. And it was surprising in its comparison with other professions where there was not as much. But yeah. Very, very interesting. Okay, so it is now 2:55, and we are at the end of the session. So I think on behalf of all of us, I would like to thank you, Louise, so much, and for coming in and giving us the presentation today, and to you and Laura for sharing your insights into your research. Thank you so much. And if anybody needs to get in touch with us, please let us know. Gina can, I'm sure, provide the connection. So thanks again, and yeah, a little bit of reaction with some clapping hands is always appreciated. Thank you so much. Have a lovely evening or day wherever you are, and we'll see you again with another session soon.
Thank you.
Thanks, Josephine. Thanks, Louise.
Bye-bye.